Select Women's Healthcare here in sunny South West Palm Beach, Florida. And today I wanted to just talk about, as a nurse midwife, what I know in regards to pregnant women and the coronavirus, also called COVID-19. So number one, I just want to reassure all women out there that are pregnant that babies are still being born safely in the hospitals. I just delivered 3 babies in this past week and all good outcomes. There are some things though that we're going to go over in regards to some of the changes that are going to occur when you go to the hospital. I just wanted to also tell you a little statistic that came out of Wuhan, China, where the virus first began, and let you know that 147 women who were pregnant contracted the virus. And of those 147, only 9 of them had serious infections that went to the point of having pneumonia. And in this single report, they did say that the babies did not get infected by the coronavirus. So there are some ideas here that I want to go over with you in regards to some of the guidelines that you should take, and they're basically the same guidelines that anyone would take in the surrounding public to prevent yourself from getting the coronavirus. Number one, the top recommendation is to wash your hands frequently, and if you're not near any soap or water, then you want to use like an instant hand sanitizer if you have that. So good hand washing, frequent hand washing, and make sure you're at least washing your hands for 20 seconds at the least. The other advice is to start to make sure that you are keeping a social distance from other people. So if you are out of the house, then they recommend 6 feet from other people, especially people that you don't know. And then avoid exposing yourself from people who are ill. So if you know that, Aunt Betty has the virus, or you think that she's sick, then this is not the time to bake her muffins and run over and try to help her out. So let somebody else do that. They're all going to understand that, you couldn't do your social duty because you're pregnant right now. So if you yourself are ill and you think that maybe it's perhaps just a cold, but you don't know for sure, just make sure that you are covering your mouth and your nose with a Kleenex when you cough or sneeze, and to make sure you throw the Kleenex that's dirty in the garbage can appropriately, and then go and wash your hands. Then the other recommendation is to make sure that you clean and disinfect all the areas that are commonly touched in the home. So door handles and like any kind of surfaces that could possibly have picked up any of the droplets if people are talking or coughing or sneezing in the area. So if perhaps someone is in the home and you have to care for them, then the advice is to wear a face mask then to help protect yourself from getting the virus. If you could put a face mask on that person, and also that you would wash your hands frequently again. And if at all possible, avoid that sick person, and that would be the best advice in regards to that. So a lot of the women are calling and they're concerned because they are not too sure what they should do now. Are they still able to come to the hospital and have their babies there? Well, I want to reassure you that yes, we are still open for business and we are having babies safely. The only thing that's changed thus far in the hospital is when you arrive at the hospital, don't bring every family member. They're only allowing one person to help assist you at this time, and that person has to stay with you throughout the entire episode of the labor, birth, and the postpartum period. So prior to even entry, everyone's temperature has to be normal, so they're taking everybody's temperature. Even the healthcare professionals, all the people that are working at the hospital we're all getting our temperatures taken so that they can at least try to protect those that are already within the hospital system. So anticipate that. So you're going to have your temperature taken upon arrival, and you're not going to have any guests except for the one person that's going to stay with you throughout the process. So you only get one choice, so choose wisely. A funny little side story is that I had a patient who actually said on Friday that she's choosing her doula over her husband because she feels like her doula would benefit her more. And her husband's like, okay, I'm cool with that. I just want you to be happy and safe. So you guys have to work it out. I don't know, duke it out at home. But so just so that you're aware of that. And the other thing is that they're trying to reduce the length of stay. So as long as there's no medical problems, they are trying to encourage moms to get home within the 24-hour period after delivery. And while there, you also want to continue to wash your hands. Don't be afraid to tell a staff member before they touch you to make sure that they wash their hands, or use the instant hand sanitizer if you're fearful that they possibly may have some germs on them too. And then a very wise thing to plan for is just the possibility that either yourself or your husband or partner could have the infection after the baby's born. So a lot of breastfeeding moms are worried too. Like, what if I get this virus? Am I still allowed to breastfeed? And as far as they know right now, and that's sort of about all of this information, everything is changing on a daily basis, sometimes hourly. But at this point in time, they're saying that they feel that the virus is not going through the breast milk, and that they're actually advocating that moms breastfeed their babies. So if you do get the virus, we don't want the baby to be exposed from your droplets from, your nose or mouth. So the advice is to pump your breast milk, and not to just pump by using your hands, but to actually use a breast pump, and to use good, as best as you can, clean technique so that you do not expose the milk in any way to anything that may possibly be on your hands. So good hand washing before you pump, and really clean the pump, so that you're covering and cleaning everything so that nothing would be passed to the baby. And then this way, someone else, if you had the virus, someone else could give the baby a bottle safely. So I know this is really trying times, and it's causing some moms a lot of anxiety, but hopefully if we all kind of take a deep breath, just kind of like the Lamaze thing, breathe, relax, try to make a plan, follow the CDC guidelines, and you will have a safe outcome for both you, your baby, and your family. So I appreciate you watching this video. If you have any thoughts or comments, please note them below and subscribe to my channel. Take care and stay safe.